Hi, I'm Dr. Lewis. I'm a veterinarian here at DePore Veterinary Hospital, and Sue, our practice manager, is going to be asking me some questions today about dogs' eyes.
What is the most important thing when it comes to taking care of my dog's eyes?
I think most of our owners are really in tune with their dog's eyes. They're looking at them all the time. It's the first thing they see when they look at their dogs. And so they're usually quite aware if there's a problem there with the eyes. The most important thing is just observation. And so we have people monitor for any discharge, which may be a sign that there's a problem, but not always. And then they should look closer and see if there's any redness in the eye or if there's any cloudiness. In that case, definitely they should give us a call. If there's any squinting, then we always want to see the dog sooner rather than later, preferably that day, because that may indicate a more serious underlying problem.
How does proper eye care impact the health and well-being of my dog?
So the most important part is, of course, just monitoring and observation of the eye, determining if there's a problem, and then seeking help in the instance or the times where we need to take a look at the eye to prevent a more serious problem from occurring. Also, we know that a lot of systemic diseases can manifest to the eye, and we may see problems in the eye before we see problems elsewhere. So then it's a good thing to look at the eye as well to determine if there's an underlying problem that may need to be addressed.
Should I bring my dog in to see a veterinarian if I suspect a vision problem?
So that's a good question, and yeah, we always want to evaluate the dog if we think that there's any change or loss of vision. At home, it's always a good idea first to try to confirm that by watching the dog move about the house. A lot of the time, vision loss can be slowly progressive, so dogs may acclimate to their surroundings well enough that they can be fairly vision impaired before it becomes evident. You can try moving things around in the house, watching to see if they're bumping into things, watching to see if they're sticking close to walls, that sort of thing. That may be an indication that their vision is impaired. And try those things in normal light and also in dim light, because some vision problems may be more evident in dim light than in normal light.
What are some signs and symptoms that my dog may have eye issues?
So the direct observation at home is most important, of course. Watching for any discharge, and then certainly redness or cloudiness in the eye is an indication that we may need to look further. And then if there's any pawing or squinting of the eye, in particular squinting, then that's something that we want to take a look at the dog sooner rather than later, preferably that day. Vision changes are definitely an indication to evaluate the dog, particularly if they're running into things at home or following closely along walls, that sort of thing. And in that same vein, we can see sometimes some independent movement of the eye, where the eye sort of twitches from side to side or up and down. And that may indicate an underlying neurologic problem that then we need to evaluate the dog for.
Why is it important to avoid self-diagnosing dog eye issues?
Well, many eye issues of the dog are relatively minor, and we can find out or arrive at a cause pretty quickly on exam. Some eye problems can be rapidly progressive and can cause some very serious consequences in very short order. Sometimes over a period of 12 to 24 hours. And then there can be a threat to the health of the eye and vision as well. And for that reason, we recommend that if there's a problem, to contact the office. A lot of the time we can work through those problems over the phone. But if it's something that sounds more serious, then we need to evaluate them to see if there may be some medication that's required or other treatments.
How will a veterinarian diagnose a problem with vision or other eye issues in my dog?
So it's a pretty standard exam when we're evaluating the eye. Of course, at first we look at the eye to see if we can see any abnormalities, whether it's in the lids, the lens inside the eye, the cornea, those types of things. And then from there, we'll evaluate the tear production in the eye, and we can also look at the cornea more critically to see if there are any scratches or ulcers by putting a yellow stain in the eye that will adhere to any scratches in the cornea. And then lastly, there's a fairly simple test we can do to detect the pressure in the eye. Most commonly, we're doing that to look for elevated pressures that can be as a result of glaucoma.